You probably have a lot of questions if you or a loved one has been diagnosed with prostate cancer. Where is the cancer? Has it spread? Will the cancer come back? Your healthcare team will use different tests to answer these questions. Keep watching to learn more about these tests and what information they give. You already know that the PSA test helps detect prostate cancer. But did you also know that it can show how well your treatment is working or if the cancer is growing? Your PSA level will be checked regularly during your treatment and as part of follow-up care after treatment ends. This is called serial PSA testing. How often will your PSA be checked? That depends on the type of treatment you're having, how long ago you finished treatment, and how quickly your PSA level is rising. How do you know if your treatment is working? Falling PSA levels are a good sign. It usually means the cancer is slowing down or the cancer cells are dying. On the other hand, if PSA levels don't fall or start to rise, it may mean the treatment isn't working well, that the cancer is growing, or that it may have come back. Monitoring PSA levels over several months can help your doctor decide if you need other treatment. Depending on the treatment you're on, your doctor may use other types of blood tests to check your overall health, any side effects, and monitor how the cancer is responding. Your healthcare team may recommend more tests or treatment based on your test results and any symptoms you have. What other tests will your doctor use? The digital rectal exam, also called the DRE, and prostate biopsy are commonly used during diagnosis and may be used if you're monitoring the cancer with active surveillance rather than treating it right away. During a DRE, which you might know as the finger exam, the doctor inserts a finger into the rectum to feel for any irregular areas on the prostate that could be cancerous. During a prostate biopsy, a needle takes small samples of tissue from the prostate to look for cancer cells. While other tests can suggest there might be something wrong, a biopsy is the only way to know that it is prostate cancer. To answer questions like, is my treatment working? How large is the tumor? And where is it in the body? Your doctor may use different imaging tests. Hospitals have machines that let your doctor see inside your body and get a picture of things like your bones and organs. One of the first imaging tests your doctor may use will help guide the needle for the biopsy. It's called Transrectal Ultrasound, or TRUS. It uses sound waves from a small probe placed inside the rectum to create images of the prostate. Your doctor may use a CT scan to see if the cancer has spread to nearby lymph nodes or other tissues. These scans create a 3D image of your organs using X-rays from different angles and can give more detailed information about the cancer. An MRI may be used to measure the tumor's size and scan your body to look for signs that the cancer has spread. MRI uses powerful magnets and radio waves to produce 3D images of organs, tissues, bones, and blood. Compared to CT scans, MRIs can produce clearer images of the prostate. PET is a newer type of imaging test that uses radiation to find cancer cells. PET imaging is becoming more common, but is usually only available if you are part of a clinical trial. It's important to understand if the cancer has spread to the bones. To find this out, your doctor may use a bone scan, an imaging test that uses a small amount of radiation. You may have a bone scan if you have bone pain or if your doctor thinks the cancer has spread. Don't worry if you aren't sent for imaging tests. Not all patients need them, and your healthcare team will decide if you do based on how you're feeling or if there is a risk that the cancer has spread. As you can see, there are a number of tests that can be used alone or in combination. Ask your healthcare team about what tests you may need, how often you'll be tested, and what the results mean. It's also important to let them know about any symptoms or concerns you have. Your doctors will use this information to adjust your treatment and give you the best care. For more information, support, or resources, visit the Canadian Cancer Society website.